Jackie here from Autism Society, and we are just getting started. I'm here with Mayra Corona today, and we are going to be talking about sensory-friendly healthcare. So it is 12 o'clock, so we'll go ahead and get started. There we go. So today we're going to be talking about Autism Society, both our national office and here at Autism Society of Texas. We're going to cover understanding autism, and then we're going to move into sensory-friendly healthcare and what things that you can do if you have a loved one with autism, whether you are a parent or support person for an autistic kiddo or an adult, or you're an autistic adult yourself. We're going to kind of give you some strategies for accessing doctor's visits, making vaccines more friendly if you want to do that, and just making things a little easier to manage. So we'll provide some strategies, and we'll also have time for Q&A. And I'm Jackie from Autism Society of Texas, and then Mayra Corona is here with me. And as you can see, she's an MD, BCBA, and LBA. That's like licensed behavior analyst. So for those of you who are not familiar with that. And then and Mayra is, I'm going to go ahead and read a little bit more of her formal bio, but Mayra has 16 years experience working with children and adults with special needs. She completed her medical surgeon degree in the University Popular Autonomous of Puebla and worked as a medical practitioner as an emergency medicine doctor in Mexico. And then after her son's diagnosis of severe autism and cerebral palsy, she became strongly involved in the world of applied behavior analysis. And Mayra recently started her own company too. Mayra has experience in a clinic setting, a home and school and community settings as well. She's also fluent in English and Spanish and proficient in American Sign Language and has extensive experience in pivotal response treatment. So Mayra, thanks for being here today. Mayra also hosts our Spanish groups and has done a lot of volunteer work with Autism Society, which we really appreciate. So thank you, Mayra. And now we'll go through. So I'm going to kind of talk about Autism Society, who we are, what we do. So we're the largest and oldest grassroots autism organization in the United States. And then the Autism Society of Texas was founded in 1990. The Autism Society of America was formed about 20 years before that, I think. So it's been around quite a long time. The mission is to create connections, empowering everyone in the autism community with the resources needed to live fully. And the vision is to create a world where everyone in the autism community is connected to the support they need when they need it. The Autism Society of Texas, I'm going to move this, is the state affiliate of the Autism Society of America. We connect families and individuals to community resources and support throughout Texas. And last year, we served 105 counties and through our Navigating Autism program, and we have connection groups or Facebook groups in pretty much every region of Texas at this point. Our core services are legislative advocacy, both at state and federal levels, our Navigating Autism program. So we provide free information and referrals, kind of support and guidance when people call in and email us. And then we have connection groups around the state for families, parents, support people, as well as autistic adults. And we have girls groups in most major cities now too, for girls 6 to 13. And all those groups are free. And then we have education events like this one, and we also have recreation events. And then let's see, there we go. And I just wanted to explain a little bit about this. So some of you may have seen both of these things. So identity first language or person first language. And a lot of autistic adults prefer autistic, like to say autistic person, and that's known as identity first. So it's that you're saying, you know, being autistic is not something like, it's not just like the separate part of me, like that's my identity, I'm autistic. And so that's called identity first. And so an identity first language puts a person's disability before the person. So you could refer to yourself as I'm autistic. And then person first, you'll hear a lot of educators say this, and a lot of families of younger kids usually will say like, my child has autism. So that's person first language puts the person before their condition or their disability. And so at Autism Society of America and Autism Society of Texas, we use both, and we always honor the person's preference. So not all autistic adults want to be referred to as an autistic adult. If they prefer adult with autism or person or just whatever, might just want to go by their name, but we always, just recognize the person's preference. But because we do have to use these words throughout presentations, we use both identity first language and person first language. So you'll hear us saying both of those. And then, all right, and Mayra is actually going to start presenting now. And she's going to kind of kick it off with understanding autism and neurodiversity. And also, I forgot to mention, but in the Facebook chat, if there's going to be a link. So if you have questions, we'll probably stop at the end for questions, or we might stop midway if we have a lot of questions. So Mayra, you can go ahead.
Okay. Could you move the slides for me?
Oh, yes, and I'll move the slides. Yeah.
First, I want to say that it's an honor for me to collaborate with Autism Society of Texas, and I'm very, very thankful for the opportunity to collaborate in helping each. I think we have the common desire to help families, and that's why I love to collaborate with Autism Society of Texas. We can go to the next one. See, what is autism? And probably all of you that you're here listening to us or watching us is because you have a family member with autism, right? And well, autism is a brain-based developmental disability. The range is very complex, and it's probably visible or not visible. Sometimes you can see, sometimes we cannot see it that very, very obvious, and it affects the brain process. It affects the way that the brain process and use information, impacting information processing, communication, sensory processing, social behavior, and emotional regulations. And then you can see a little. I love this visual, and this visual shows like, okay, there is all the parts that are affected for the autism: communication difficulties, social impediments, intense focus interest. But if you see the examples in A, B, and C, a lot of people, they have more and less than other. And one of the beautiful things about working with patients with autism for 17 years, I could say, I can never ever found one kid or another person with autism that is similar. And one of the things that we do is support neurodiversity. And we want you to think like in the computer. I want you to think like just as computers and cell phones. They are different operating systems, right? So our brains, they do it. So it doesn't mean that the iPad is better than the iPhone. They're simple different. If you try to get an autistic brain to be neurotypical, it won't work properly. And not because the brain is broken, it's just because we're trying to get it to be something that isn't it, that is not. So it's not helpful to punish the autistic brain for not being neurotypical. Instead of that, we can change our approach and make accommodations. Next. Okay, processing information. I want to say before reading this slide that there is a lot of research that shows that the number of connections in the brain is different and is higher in autistic brain. So what does mean? So that means that the way that the autistic brain process, it's different. It might process usually in the processes, the information comes in, the information gets stored in your brains, the information gets, then they have to get out the information when we want to, for example, express ourselves or talk. A lot of people get the entire process it might be affected in the brain with autism. Some example of communication difference or communication what I want to say difference or in a patient with autism is expressive is when the ability to communicate verbally. Some of them they're verbal, some of them they're partial verbal or non-verbal. Inconsistent access to verbal, or sometimes no access to verbal language, and receptively, some of them they have access to verbal language, but but they have trouble understanding or using social pragmatic language. For example, we joke and everybody laughs because we know it's not real. But sometimes of them, people with autism, they don't understand the pragmatic language. They don't understand jokes, or sometimes they do. Processing speed or styles of language. Communication, 25 to 30% of people with autism is not speaking through the entire life. They're nonverbals. Additionally, 20% might present as a nonverbals when they highly stressed. Occurs both with and without intellectual disability. In communication support or other way, communication supports other way to communicate. For example, one of the things that support communication is sign language or icons, pictures, technology. A lot of there is a lot of apps, and both in app iPad or in the Android, that they have a very cool support languages or writing the directive. And sensory processing. So sensory and movements difference might have significant impact of self-regulations and feeling of safety in one's body and in the community. Typical people, we all time, at all moment, we are regulating the sensory. We're regulating lights, touch, sound, and it's this is what our brains do. A patient with autism, they have a strong difficulties processing and regulating sensory. And individuals with autism tend to filter incoming sensory message differently. They might find some experience extremely overwhelming and might not notice others. So we're going to find a lot of sensory misregulation in each one of those senses, like a sight, sounds, balance, interoception, touch, smell, basically in all of our senses. What is steaming? And we were trying to explain this. We couldn't find the translation in other languages, but steaming, we call this word in all languages steaming. So it is a repetitive body movements or repetitive movements of objects. So, for example, when patients with autism, they repeatedly like spin around, there is spinning, pacing, rocking, spinning. What I do a lot when I am with myself is like touching my hair. That is also steaming. And yeah, you can look at the other one. Too much information can cause stress, anxiety, and possible physical pain. This can result in withdrawal, distress behavior, or meltdown. If I get sensory overload, then I just shut down. You can get what's known as a fragmentation. It's weird. It's like a being turned into at 40 TV channels. When I read this slide, I like to think that even people who are typical people, and our brain and our body is regulating all the sense, we are stressed. We are all time on this. Now imagine having our body or brain no processing and no filtering all the sense, it is even more stress. So it's usually that they just shut down, they just fragment, and they just they just melt, they have those meltdowns. Inclusion is the foundation for the core issues affecting the global autism community, and it's a big goal in Autism Society of Texas. We want accessible healthcare in the autism community. Social determination of health, screening and diagnosis and co-occurring medical conditions, trust barriers, misinformation, and lack of healthcare training. We're going to talk about all kind of this in the following slides. There are barriers, or families, or people with autism. We have barriers for finding healthcare around us, like individual barriers. Sensory, a lot of our kids, a lot of my clients not easily going to a doctor just because they have a sensory issues. They cannot walk into the room, social, cognitive, communication, or emotional. So, and also we have access barriers like a lack of accessible education and information for both sides, from the family side or from the provider sides, lack of services and support, lack of training providers in transportations and process barriers. And systematic barriers like a stigma. A lot of people, we don't want to put the name or the label of the child, so I'm not going to take it to the doctor because I don't want him to have the label of autism. Misinformation, language barriers, racial inequities, or financial barriers. All of those are barriers of really impacting our community. And screening and diagnosis. Sometimes there is a barrier in the lack of knowledge and social stigma, dismissal of first concern by the healthcare providers. Sometimes the parents are the first to notice, like something is weird with my child, and I'm going to something is different. What I want to say, something is different with my child. I feel like it's not reaching their milestones. Going to the doctors, and this happened with several of my clients, that they take them to the pediatrician for first time, and healthcare providers, they say like, no, don't worry, it's gonna talk later, don't worry, let's wait until 3 years old to get diagnosis. Barriers to screening, they're very, I am in the state of Texas, I am in Houston. I don't know much about other states and other cities in Texas, but in Houston, we have a very few diagnosticians. It's a big barrier to screening. We have way more neurologists, we have way more pediatricians, but very few diagnosticians. Access to services, it's also another barrier. Trust barriers, a lot of misinformation on what is the right treatment for them. I'm also a mother of a child with autism, and I remember when I was, before getting in the field of ABA, and still after 15 years, 16 years, a lot of my families, they go through, when they receive the news of autism, they don't know what it is. They go into Google, and they just open Google, and they open a bunch of things that they might or they might not be the right treatment for them. It is a lot of information on the websites. Vaccine contemplations, some of them, they're like, oh, hesitant to do vaccines or not, history of trauma, and trust in the autism community. We are confused. We kind of like, okay, one group says something when another group of parents say something, and it's also all of those are trust barriers. Co-occurring conditions. 1 in 36 children are diagnosed with autism. Around 1/3 of the autistic children are identified with intellectual disability. Nearly 3/4 of autistic children are diagnosed with co-occurring medical mental conditions, and anxiety disorder affects up to 40% of the individuals with autism. And one of the things that we want to say is vaccines do not cause autism. And there is research that shows that vaccines do not cause autism. And healthcare training, healthcare providers report feeling less confidence in their ability to provide quality care for patients with disability. Only 40.7% of physicians were very confident about their ability to provide equal quality care to disabled patients, and only 56.5% strongly agree that they welcome disability patients into their practices. The healthcare utilization, the vaccinations rate among people with autism is alarming, low, despite the fact that those with autism and developmental disability are more likely to experience comorbidities, placing them in a higher risk of hospitalizations, ICU admission, and even death. I was talking with Jackie when we were preparing this one. I was telling her that personally, in my experience, when I finished my career and I become a medical doctor, and then I was given the diagnosis of my son, it was scary for me as a healthcare provider that nobody trained me. I was a doctor, I was an ER specialist, and I was not expert in autism. I didn't even know what happened with my child. And it's still, there are a lot of there still is a room and opportunity in the field of MDs that we need more and more trained in what is autism. And our goal is to create a health equality. And then this is why one of the things that I admire the most about Autism Society of Texas, I have the opportunity to collaborate with them in the past. And I think what they do in the community is very beautiful because they really are working on having health equality. And
Okay, yeah, thank you, Mayra. And then I'm going to talk a little bit about this and why we're talking to you all about sensory-friendly healthcare. Some of you all know that last year we did a vaccine education initiative, and most of that was around COVID-19 vaccine. But we learned a lot about like people's needs and what family needs are when they just go to the doctor, or what are the needs of autistic adults visiting the doctors. How can it be more welcoming and accessible? And so the goal, as we move into this year, we're looking at not only vaccines, but also just accessible healthcare and making it a pleasant experience and making sure people go, they're not fearful. And so we're really leveraging the power of connection, and that's to provide education, inspire confidence, and create accessibility. And last year we did this, we learned a lot, and a lot of the things that we did, we're actually going to use this year as well. We're going to partner with a lot of different cities, so we'll be doing more outreach in like training healthcare providers and public health authorities about autism, how to be sensory friendly, how can you provide accommodations. It's really, we discovered last year during our vaccine education initiative, it's not that hard to provide accommodations. It's not expensive. It's pretty simple things that we can train them on. And it's also things that parents and support people can learn and take away from this and do themselves when they take their own loved one to the doctor, whether it's just a routine annual checkup. You can use a lot of these supports and ideas. But we've got different kind of ideas for support that make your appointment more accessible. And that's like pre-registration, thinking about sensory and environmental considerations. We also have links to materials on our website. So those are things like social stories and communication boards. And all of these are universally designed, so they're going to be helpful for everybody. And then the main key in prior to going to the doctor's office or to get a shot, and this is any shots that you might want to get, like flu shot or anything else, or even just a doctor's visit, is plan ahead. So a lot of you, if you're parents or you're autistic adults, it's going to help to plan ahead. And that can look like all of these things. So considering what are like favorite items, whether it's like a weighted blanket or a lap pad, having a visual schedule, having fidgets on hand, bringing your noise canceling headphones or earplugs. And then for our clinics as well, last year, and we'll be doing this a little bit, we're hoping to do one, have a clinic at some of the major cities for back to school as well. And we'll be partnering with health authorities. But if you get to plan ahead and sign up, we actually found out like what were past experiences, what accommodations can we make for you in advance, and is there anything else we should know? But that's also something you might want to call your provider, and say like, hey, my child has autism, or I am an autistic adult and I have anxiety, I need these things. Or so kind of learning to self-advocate if you're autistic yourself, or if you are a support person or a parent, to kind of think about these things before you go to the doctor's office and try to make it as smooth as possible. You can even find out if you can do paperwork ahead of time, bring snacks, bring safety items. You can bring treats if you want to. So those kind of things. And then let's see, we have all of these. So a lot of these were from our materials from last year. And so they're all COVID-19, but a lot of these can be about getting a flu shot, just visiting the doctor in general and what to expect. But these are all going to be on our websites. And all of these help people kind of be prepared and less anxious when they're actually going to the doctor so they know what to expect. And Mayra, did you want to add anything here? Or you kind of?
Yes, I had the opportunity to collaborate with Autism Society of Texas in one of the vaccine campaigns, and they were very, very useful, those materials.
Awesome. Yeah. And then, and those, yeah, and these are available for everybody, and we have them in English and Spanish. And we forgot to mention that Mayra will be doing this presentation with Adriana in Spanish in a couple of weeks from now too. So we can add that it might already be on our website. And then Mayra is actually going to talk us through some of the different communication supports you can utilize when accessing healthcare, making doctor's visits.
Yeah. Could you go to the next one, please? Okay. One of the things that is really important to know is, people with autism, they respond very, very, very well to visuals. They communicate very, very well to visuals. So it's really important to support them with visual as much as possible. Those, the pictures that you're looking at now, they're created by Autism Society of Texas. I have the opportunity to use those in our vaccine clinics. And it was really amazing because I had the opportunity to see kids really pointing at those pictures. And the beauty is now that the vaccine clinics are no longer like now we can expand this, even not just only to vaccines, we can expand this to any doctor appointment. So those are some examples, and I think they're also you can reach out to the Society of Texas. They have this. They provide those for free, and I also experienced going to a conference when Autism Society of Texas is providing those a lot of those examples of those visuals to BCBAs, to therapists, because they want people to start using it.
Yes, absolutely. You're right. We have been handing these out to therapy providers as well as families, and they'll be downloadable from our website as well. So they are a really good tool. Okay.
And some kids, they need visuals. Some kids, they need something that is called AAC, Alternative Augmentative Communication. There means usually there are apps that they can be downloaded, and they have the opportunity to use the app so that the child touch a button and the app talks, they may give them their voice. We can be in iPhones, tablets, symbols, and text-based, or all of the above, right? And the good thing about AAC is customizable to the level. Some of child, they don't read and write, so they're pictures. Some of them, they don't understand like a clip art. They have to be in a real object pictures. So the beauty about those AAC is so you can customize those as your kids need. And sensory and environmental support, that's really important. Understanding that they have a sensory needs. Now we're gonna customize the environment. So it is important to create accessible environments. Reduce fluorescent lights. Ask your doctors if they can turn the lights off, or ask your therapist if they can train your kid of using a sunglass. That is going to help a lot. If the kids already tolerates having a sunglasses, this is one of options. Variety of seating options, or kids sometimes they're like they like to move a lot, and usually in the clinics they have a different seating options for kids with autism. They have a ball that if they can bounce. They have like something like they might rock. And sometimes my own personal child, he does not like to be close to walls. So a sitting option is just to move a chair far from the wall. And noise canceling headphones, this is another option for kids that are very oversensitive to noise. Sensory fidgety toys or tools, that's really cool, because when they are with those toys, they distress a lot. So one of the things that Autism Society of Texas, they have is this beautiful bag with everything, kind of like everything that you need for going to the doctor. And that includes a lot of toy and a lot of sensory fidgeted tools and toys that I have a couple of those in my son's bedroom. So whenever you're stressed, go get your toys and play with it and distress yourself. Visual barriers and boundaries, and that's why the visuals create that we create a lot of visuals, and reduce crowding. So ask when your doctor has the less patients in the clinic. So kind of take your child whenever it's more like a more calm, and you can say, can I have the first session in the morning 7 a.m. because most likely no other patients are going to be first in the morning. This is something that sometimes we do. Or sometimes the last one, when all your patients are gone and it's quiet, and can we turn the TV on or off in the clinic? So, and don't be afraid to talk with your doctor. Don't be afraid to kind of request them. I think they will appreciate that you asking for that.
Yes, I definitely agree. I just from personal experience, if doctors and professionals don't want to be accommodating, it might not be somewhere you want to go in the first place. So, so a lot of times, just asking for like really basic accommodations, or asking them when it's the quietest, and giving them a heads up, your child or your, your loved one, if you're bringing an autistic adult, has autism, and hopefully I found that most professionals are willing to work with you and be helpful. So you can kind of explain that it'll make the process go smoothly, and it's less for them. It's difficult for them if your child is having a meltdown or a tantrum at the doctor's office too. So it sort of is more pleasant for everyone, I find.
Yeah.
Okay. All right. And I'm going to just talk through this a little bit. This is what Mayra was talking about. What we gave out, we had these at our clinics last summer, and we'll be giving these out to the public health authorities that will be training about autism. And Mayra can talk through the next slide too about how they're used, but these are a lot of like sensory friendly things. And we're hoping we might actually have some of these kits to give out to families as well. But noise canceling headphones, this is called a shot blocker. And the little plastic nubby things kind of like spread out. It's like your nerves it just distracts you from the actual shot. And then of course we had little spinners and stickers, and this Buzzy Bee you'll see in the next slide, and Mayra can kind of talk through that, but that's kind of a sensory kit, but you can always put your own together for your loved one of like preferred things and things that they're going to like and be able to use at the doctor's. So, all right. Mayra, I'll let you take it from here.
Yes, supporting the whole family. It's really important in different ways. It's really important that we provide support as the entire family, and also train the entire family to support each other. One of the things that I love a lot from Autism Society of Texas is the support group that they have for moms, and they have support groups per state, per city, support groups in Spanish, support group for dads, support groups for siblings. And it's really important to focus on the entire family. I know there is a member with autism, but we're supporting not just only the member with autism, we're supporting the whole family. And also teaching the families to support each other. Healthcare provider support. This is one of the things that I was also very, very thankful for Autism Society of Texas. When we did the vaccine campaign, what Autism Society of Texas did in several cities in the state of Texas, they collaborate with behavioral ABA providers along with healthcare providers like nurses. And actually, Autism Society of Texas train the nurses in how to interact, and by the combination of having their BCBAs with the healthcare providers in learning together. I was able to be into campaigns, and I have an experience like that I think probably is going to be in my memory for a long time, that we have a child who didn't, a little girl who didn't want to sit in a seat next to the desk to get the vaccine shot, and the therapist was working, doing some modeling with dolls, and they were on the floor, and every time we see the girl on the chair, she was kind of like crying, so we put it back on the floor until the therapist started kind of guiding the nurse how to come to play, and we're doing some role model with the doll until the child say, yes, I'm gonna get my vaccine. And the nurse was able to get the vaccine in a different way, not at the desk, not at the chair, but at the floor playing. And it was, the nurse was making sure that everything was sanitized, that everything was, and the BCBA was making sure that everything was, the behavior was in control. It was beautiful to see how Autism Society of Texas provide that support, that training to those healthcare providers. This is one of the tools that that we use during our vaccine campaign. The first one, it is a letter B, is a buzzer. So that letter B, it's a kind of a machine, and when you turn it on, it buzzes. And also, you see the wings on the B. Those is an ice pack. So you put it on the arm, and then you buzz it. And the idea is like it provides a lot of sensory. When you get the needle, basically it doesn't feel, kind of numb you, the arm doesn't feel. And the other one is that, I forget the name, Jackie, the shot blocker. The shot blocker is there, the name. What is that? Is the same, provide you a lot of sensory?
No, it's a different thing, because the Buzzy Bee actually, like you said, it has a battery and it buzzes and it's got the little ice pack. And then the shot blocker, it's hard to see in this picture. I wonder if you can see in the other picture. Here you can kind of see it better. But it's got little plastic nubs on it. So it doesn't hurt, but they're like little plastic bumps, and you put it on your arm. And again, it's like, instead of focusing where the shot is going, it's kind of like spreading out the feeling, your nerves are kind of feeling all those bumps, and it kind of distracts from the actual shot. So this is called the shot blocker.
Yes. And
yeah.
The families where the families receiving one of those, and a lot of families, they say, this is going to help me a lot, not just only for the COVID vaccine. All our kids, they get vaccines through the childhood all the time. Every time that you get any kind of vaccine, any kind of injection, it helps. So
yeah, so that was the Buzzy Bee, and it's kind of showing. And so what we did too, to make things accessible, the people that were giving the shots, whether it was like Austin Public Health or the City of Houston Public Health Authority, we would actually train them on how to use these little Buzzy Bees, how to be autism friendly. And so that's what we'll be doing again in a lot more cities, so that whether people are getting shots or not, a lot of these healthcare providers have then had training on how to be autism friendly. Plus we have these tools if you do need to get shots. Okay. All right, Mayra, I'll let you do this one.
Okay.
There we go.
Other high impact strategies, relational support, high interest of passion areas. And that's important, that when our kid or person with autism, they have high interest on passion areas, to support them in that area. Caregiver informed strategies. So inform our caregivers as much as possible about strategies that they can use to get those children to the doctors. Community partnership. One of the things that Autism Society has done is a really, really good collaboration with a lot of the community. Autism Society of Texas, it collaborates with several resources around. Facilitate choices and autonomy. Like if you want to bring your child to the doctor, probably snack choices, PDG choices, Band-Aid choices, and bring a lot of things that are going to help you in that appointment. And I love the last one, the last 3 P's: predictability, patience, and play. And I could say probably is 1 P of predictability, 10 P for patience, and 1 P for play, because we need a lot of patience with those beautiful people with autism.
Great. Okay.
And what my person might need, all can benefit from. So actually, that was one of our experience that we have in that vaccine, and they were using the visual support, and what one person might need, all can benefit from. So that's the idea of, if it's going to help for one, it might help to more than one kid, or more than one, and in this case is an adult.
I just realized I was on mute. Yeah, definitely all of these tools help. In fact, we were talking about planning for next year, and we may be partnering with some school districts as well. And we were saying that a lot of these tools help all kids. There's plenty of just kids in elementary school that are scared to go to the doctor or scared to get a shot. And, and so a lot of this material is helpful for everyone. All right, let's move to the next slide. Okay, and I'm actually going to talk about this. We made a video just kind of explaining some of our accessible healthcare and how things went last year when we did this. And so I'm going to go ahead and play this little video now. I'm going to try to minimize ourselves and try playing the video. So let's see how this goes. And Mayra, you might want to mute yourself too while this is going. I think this will be okay if you can. And if not, it's okay. All right, here it goes. This is just like a 1-minute video.
The ongoing impact of COVID-19 is felt by us all. People with autism are more likely to experience severe symptoms and complex barriers to healthcare. Individuals with intellectual disabilities are also 6 times more likely to die from this disease. We see you. We understand the unique challenges the autism community faces. The Autism Society is committed to vaccine education, confidence, and access through our Vaccine Education Initiative. Together, we are reimagining the vaccine experience. We prepare, educate, move, respond, and support.
I got my vaccine today, and I didn't.
Visual schedules and social stories prepare vaccine recipients.
Today at the vaccine clinic, it was my first experience using social stories, communication boards, and visual supports to help ease the children's anxiety and help prepare them to receive the vaccines that they needed.
Healthcare providers receive training to facilitate a supported experience. Because of this, our vaccine clinics have a 99% success rate.
This was a successful vaccine experience because of the healthcare providers here, the play therapists, the accessory supports used for the injection sites, being in their own environment. It made it very welcoming and comforting.
Another great thing we've been able to do with the clinics is offer parents the option to do a drive-in. So they don't even have to come out of their car. We can just pull in, they call us. Our public health workers have been amazing and just gone out. We've talked to the parents, done everything, gotten the shot, and they're done in minutes.
Because of the strength of our affiliate network, we have hosted over 50 educational events and 30 vaccine clinics across the country. Because of you, we continue to advocate for a more inclusive, supported healthcare system.
I could not ask for a better experience. It's for all. It's for all people. All kids can benefit from this.
The toys, to the stickers, to the snack bags, to even the shot blocker made a huge difference in making the experience of getting a vaccine so much more calm and a positive experience.
It made me feel a lot more like I was at a friend's house rather than getting a shot. I wish I could get all my vaccines moving forward like I did today.
The Autism Society of America is charting a path to improve health equity to ensure that the autism community and their families have both the access and the opportunity to obtain full health potential.
Together, we can be the connection. The Autism Society. The connection is you. Get connected at autismsociety.org.
Great. So, all right. So that kind of gives you an idea of, what you can expect when you use all the tools and people are prepared. These work, as you saw, we had a whole span of age ranges there from very little through autistic adults that were able to access and have a positive experience. And, families were happy. We also, and we didn't just do the shots for the kids. It was also the parent, caregiver, attendant, like anyone that's supporting that person. It's not like, oh no, you go to your own doctor. So we're able to support the entire family at those events too, which was great. And we learned a lot of things from doing that really. That was really helpful. Hold on, I have lost my, hold on. Oh, there we go. Sorry, Myra, I was like, I lost my mouse for a second. I can't scroll the slides on. So we can continue, but that kind of gives you guys all an idea of like what it looks like to use all these accessible tools and how it works. And we did have a lot of success with it. So Myra, do you want to go ahead and talk about the key takeaways from all this?
Yeah, like the key takeaway of this meeting, this talk, it's talk about the misconceptions, like healthcare is difficult for patients with autism. No, that's a misconception. If we really educate families, if we really educate providers, if we teach the family to make their own tools, if we provide tools, it shouldn't be a difficult. Understanding hesitancy. I know we understand that it's difficult for a parent to kind of like reach, but that's why we are here to support, we're here to help. Importance of partnership, and this is a strong in autism communities of Texas. They partnership with a lot of providers, like not just only in the ABA field, in with doctor, nurses, in a lot of partnerships. We have to get together to support our patient with our community with autism. Need for training. We understand that we still need for training. We're gonna continue training those providers, continue training the parents, and tangible resources, continue providing those beautiful and useful visual, the block shockers, and universal impact. So if we make, I hope we can make a change in the community and the flow of healthcare. This is our goal, to make a big change in the healthcare community. Accomplishment: educate community about safety and accessibility, empower communities to meet diverse needs, create connections through community partnerships, and transform the healthcare experience, build trust, confidence, capacity, and inclusion. And you and me, we really invite you to get connected. Go, Jackie.
Yes, absolutely. So we've got a lot of resources. We have a downloadable, I'm not sure if we put this on Facebook, but we will in our presentation. We'll put a link to our website page where you can actually download some of the healthcare communication boards and the things that you guys that we've just presented. You can also email us if you need help. And that's not just for any of this accessible healthcare stuff. We have a navigating autism program that we serve the entire state. So if you need information, support, guidance about anything autism related, and that's new diagnosis to really anything, honestly, we'll help with anything. And that's for adults as well. So we do a lot of programming for autistic adults too, as well as families. And the other thing, we did have one question, Mayra, and it might be something that you can answer because it sounds like it might be something that could use behavioral support. So a parent asked when she takes her son to the doctor, her son will not let the doctor touch the child. So can't check ears, can't check anything, can't check chest, nothing. And so this person said, what do you suggest? Should they switch doctors? Is there something else they should try so that their child is like actually getting checked sufficiently when they go to a doctor's visit?
Thank you for that question. Well, it is probably we'll need to know more about the context, but for example, if the child doesn't allow the doctor to touch himself, but also doesn't allow anybody, it's not the doctor, just like anybody to touch himself, like the dentist, the nurse, it's not particularly to the doctor, is the child does not tolerate to be touched. If that is the case, behavioral support helps a lot. I don't know if you have access to ABA training. So basically what we do is we start shaping the behavior of tolerating me having being touching my ears, touching my mouth. And we start with something very simple. We're gonna touch with a little spoon, we're gonna touch your lip, right? Or with a little, like with a little spoon, or with a little like a wood thing, we're gonna touch your tongue. And we're basically the training the child, desensitizing him to be in touch. How we do in therapy? We do it, most of the ABA providers right now, most of them, either in a clinic setting or the ABA setting, they use something that is called NET, naturalistic teaching, or based on plays. So most of this means like we're doing it while playing. So you can play with the doll and with a like, okay, I'm gonna check the doll. I'm gonna check his ears. Now let me check your ears. Now you're the doctor. Now you checking me. So basically we are kind of like training the child in the either in the home environment or in some cases in the clinic environment. When the child masters that skill in that environment, the ideally is to get the child in the real environment, which is this in this case is the doctor. And this is when you have to talk with your doctor. Please make accommodations for me. In my own personal experience with my child, we did a deep cleaning in the teeth by going to the dentist, sitting on the dentist chair, and then go back home, and then going to the dentist, sitting in the dentist chairs, and then go back home, and then going to the dentist, sitting in the dentist chairs, and allow the nurse to kind of like a touch with one of the tools, touch and clean one teeth very, very quickly, and then we were able to accomplish the full cleaning in probably 10 or 15 sessions with the doctor. It's very difficult to find a doctor who allows you to do it. But I think if you explain them and if you give options, like I can come 7 in the morning and I can that's basically, this is my recommendation for the person who asked that question.
Yeah, that's great. And also on our Facebook page, sorry, I've got this screen and I'm looking at our screen as well, but we have been posting our sensory friendly healthcare resources in the comments on Facebook. So you can look at that stuff. And I was going to say, I definitely everything Mayra said to get ready. We didn't get the age of how old this person is, but I think for when you have kids, you can get those little Fisher Price, the doctor's kits, and you can actually look and do it at home. They can do it, like get used to some of the things, and also either look at images online of what does like the ear, I don't even remember what that thing is called. The thing they check your ear with though, look at pictures, and preparation is key. So it might be something that you could, if they have an ear infection, or you think they do, you might want to make a social story like, Dr. Jane's looking in your ear because it hurts. Why? It hurts. Like, Dr. Jane needs to look. So like, it might even be something you can make a simple social story for to explain, or try to use some of our healthcare resources before you go to the doctor as well. But I think, it's always like preparation always reduces anxiety, and like Mayra said, work up to something, maybe make a visit and don't do anything. And so anyway, yeah, we're all about preparation. Preparation reduces anxiety, so that's always helpful. And let me just see if we have any other questions, but I don't think we do. Anybody, y'all are welcome to email us though, and if you have like a behavioral type question, we can ask Mayra and get back with you as well. But all these resources are up on the website. So, up on our Facebook page and on our website. So I think that is it for today. We appreciate you all joining us, and this will be on Facebook and YouTube for quite a while. So with that, I'm going to stop sharing and go ahead and end this live presentation.